Mental Health First Aid. Mental Health First Aid is a training program that teaches members of the public how to help a person developing a mental health problem, including a substance misuse problem, experiencing a worsening of an existing mental health problem, or in a mental health crisis. Like traditional first aid, Mental Health First Aid (mhfa) does not teach people to treat or diagnose mental health or substance use conditions. Instead, the training teaches people how to offer initial support until appropriate professional help is received or until the crisis resolves. While first aid for physical health crises is a familiar notion in developed countries, conventional first aid training has not generally incorporated mental health problems. The Mental Health First Aid program was developed in Australia by Betty Kitchener and Anthony Jorm in 2000. Since 2003, this Mental Health First Aid program has spread to a number of other countries: Bermuda, Canada, Denmark, England, Finland, France, Germany, Hong Kong, India, Ireland, Japan, Malaysia, Malta, Netherlands, New Zealand, Northern Ireland, Saudi Arabia, Scotland, Sweden, Switzerland, United States, United Arab Emirates, Wales. By 2019, over 3 million people had been trained in mental health first aid worldwide. MHFA training programs typically last around 2 hours and include modules on recognizing signs of mental health problems, providing initial support, intervening when necessary, and referring the person to professional help. There is no universal definition of mental health first aid, but most programs use the following 4 core principles. 1. Listen attentively, pay attention to the person's words and body language. Acknowledge their feelings, needs and concerns. 2. Calmly, avoid being over-emotional or judgmental. Set limits on the situation you are in. You can't fix everything, so decide how much of a helping role you want to take part in at this point. Don't put yourself into an uncomfortable position where your emotional state gets triggered badly and doesn't respond well because it's not really necessary for basic caretaking tasks, including personal care and personal hygiene. Create a safe environment. The person may be experiencing a psychological crisis, which can lead to the need for immediate help. He or she is not suddenly going crazy on you if they are asking for help with their mental health problem. Be clear about what your role in helping this person should be until professional services are received by them. Provide basic level of care that includes verbal support while they decide if further help is needed as well. The mental health first aid training offered by mhfa programs aims to improve the quality of life for people who are experiencing or have experienced psychological distress, and helps them to recover from their experience so that they can function better in both their personal and professional lives. What is mental illness? Mental illness is a medical diagnosis that describes any psychological disorder. It affects behavior, emotions and cognition in varying degrees of severity. Mental illnesses are often associated with chemical imbalances within the brain or nervous system, although there are also many different types of mental health disorders that have no underlying biochemical cause. Although all serious psychiatric diseases can be debilitating at times, most people recover from them to lead relatively normal lives as long as they take the necessary medication. Most mental illnesses have no known cure, and treatment is focused on managing symptoms while preventing the occurrence of future episodes. What are mental health problems? Various types of mental illness include major depressive disorder, bipolar disorder, schizophrenia/psychosis or a psychotic episode, as well as other conditions such as anxiety disorders, eating disorders or attention deficit hyperactivity disorder, ADHD. The prevalence rates for these measures vary from country to country, but in many countries there are significantly higher rates of mental illness than physical health conditions. What are signs of mental health problems? Some common signs of mental health problems include feeling overwhelmed, feeling anxious or stressed, having trouble concentrating, feeling like you can't escape your thoughts, being moody or emotional often, withdrawing from friends and social activities, experiencing physical symptoms like headaches or stomach aches. Sometimes it's hard to tell if someone is experiencing a mental health problem because the symptoms can also be caused by things like stress or anxiety. If you're concerned that someone you care about is suffering from mental illness, it's important to take their symptoms seriously and seek help.